Welcome back. I'm the Intense MD, a double board certified intensivist, here to give you an inside look into the intensive care unit. September is Sepsis Awareness Month, so I figured I'd make a video about just general information about sepsis to let you guys know what sepsis is and how we treat it in the intensive care unit. So first, what is sepsis? So the official definition of sepsis is life-threatening organ dysfunction that leads to dysregulation of the host immune system. So that pretty much means an infection causes the person's immune system to go into overdrive, which causes a whole host of other issues. So how common is sepsis? In 2017, the WHO reported 48.9 million cases worldwide and 11 million deaths related to sepsis. Their statistics showed that this led to approximately 20% of the deaths worldwide, which is 1 in 5 people dying of sepsis each year. In the United States, the CDC reports each year approximately 1.7 million people develop sepsis. Of those 1.7 million people, 350,000 will die, and 1 in 3 people who die in the hospital have had sepsis during that hospitalization. That doesn't mean that sepsis was their cause of death, but during their hospitalization, they were diagnosed with sepsis at one point. Who is at risk for sepsis? Usually those who are very young, less than 1 year old. People over 65 years old are also at high risk. People with chronic illnesses or compromised immune systems, such as people undergoing treatment for cancer or having cancer alone can change your immune system. People who have HIV and AIDS who are not taking their antiretrovirals and have a compromised immune system, or those who are post-organ transplant. Why do we care so much about sepsis and what makes it dangerous? So like I said earlier in this video, sepsis is due to a dysregulation of somebody's immune system and it puts it into overdrive. This causes a lot of inflammation throughout the body and it makes the body react in a very dramatic way to try to fight this infection. It can lead something that we call septic shock, when the blood vessels dilate and that drives the blood pressure down. And I've spoken in many other videos that when you have low blood pressure due to an illness, this leads to your organs not getting the amount of blood they're used to. They're not getting the oxygen and nutrients delivered in blood, so that can lead to these organs to fail. Commonly, we'll see people with acute kidney injury or kidney failure needing to go on dialysis while they have sepsis, respiratory failure, needing to go on mechanical ventilation. It can also cause liver injury or liver failure. So every organ can be affected by sepsis because all of our organs rely on having appropriate blood pressure. So when somebody develops septic shock, we need to take care of that very quickly to prevent further organ dysfunction. So how do we diagnose sepsis in the hospital? So you have to have some suspicion of there being an infectious source. Even if we don't know the exact source of infection, you have to have some type of suspicion that this patient may be infected, and they'll have signs such as fever, increased white blood cell count, other things that will lead us to believe that. And also they have to have some sign of beginning of organ dysfunction, which goes along with the definition of sepsis. There are different scoring systems that we use. We'll use the SOFA score, the NEWS2 score, SIRS criteria to determine if this patient meets the criteria for sepsis. And even if they, at the end of the day, do not have sepsis, we usually go ahead and treat for sepsis until we're proven that they do not have an infection, just because it is so life-threatening. So specific things that we do to treat sepsis in the hospital, there are guidelines that we follow. There are numerous studies that show that doing these things can reduce the chance of this patient dying, or what we call patient mortality. We usually start off by giving IV fluids. The amount of fluids we give is 30 milliliters per 1 kilogram of body weight per patient. So each patient will get a different amount of IV fluids depending on how much they weigh. Another thing we do is very early broad spectrum antibiotics. I discussed in my ICU medications video that broad spectrum antibiotics are antibiotics that cover all different types of bacteria. We usually cover what we call gram-negative and gram-positive bacteria, just to make sure we have all of our bases covered while we're waiting for culture results to come back to tell us what specific bacteria we are targeting. So something that goes along with the diagnostic workup is drawing blood cultures, also typically getting urine and sputum cultures to see what bacteria is growing. And then from that, we will get data from the lab that will tell us what antibiotics this bacteria is most susceptible to and resistant to. Because if the bacteria is resistant to the antibiotic we typically use to treat it, then that will do nothing for the patient. So we need to know exactly what antibiotics are appropriate for this specific patient in this specific infection. Another way that we treat sepsis is something called source control. So if we are concerned for a patient having a specific source of an infection that we can take away, such as draining an abscess, if somebody's gallbladder is infected, we might put a drain in the gallbladder to drain away that biliary fluid and let the gallbladder cool down. And ultimately, most likely the gallbladder will have to be removed, but sometimes it is too dangerous to proceed with that surgery while somebody is in septic shock. But otherwise, we give antibiotics and we do something called supportive care. So a lot of what we do in the ICU is to support the patient's body while it tries to heal. We'll put them on life support with the ventilator and medications to try to push their blood pressure up. If it looks like their heart's having trouble pumping, we will give them medications to force the heart to pump harder. We'll put them on dialysis if they need it. But at the end of the day, doing all these things is to support the patient's body. If the patient's body is too weak from the infection, they may still die despite all of these things we try to do to support them. So how do we prevent sepsis? So for at-risk individuals, particularly those who are immunocompromised post-organ transplant, many times they'll take antibiotics prophylactically, in essentially preventative antibiotics to prevent what we call opportunistic infections. These bacteria, when somebody has a weak immune system, are opportunistic, so they come in and infect the patients. People who have AIDS, people who are post-organ transplant may take antibiotics every day to prevent certain infections, and I can talk more about that in another video. There are also the obvious things such as washing your hands. If you have a wound, making sure you took good care of that wound so it doesn't get infected. Particularly many diabetics will have foot ulcers that they need to tend to make sure that they do not get infected, because again, diabetics do have a compromised immune system. And also getting any age-appropriate vaccines, such as the influenza or pneumonia vaccines, can help prevent sepsis due to these sources. So there is the Surviving Sepsis campaign, as well as the Sepsis Alliance, which are two organizations trying to educate healthcare providers about looking out for causes of sepsis, treating sepsis appropriately, and just having a low threshold for treating patients for sepsis since it is so deadly. If you have any questions about sepsis, please leave them below. I hope this video was helpful to you. I will be back next Tuesday with another video. Thank you for watching.